What do we know about sensory issues in individuals with Angelman syndrome? Well, we know from studies of basic neuroscience that sensory processes are disrupted in Angelman syndrome. The UBE3A protein is necessary for maintaining the brain's response to sensory experiences during development. Clinical studies of individuals with Angelman syndrome have shown that sensory-seeking behaviors, and these are things like mouthing, biting, fascination with water, examining very shiny objects, or having a very high interest in plastic, are very common amongst individuals with Angelman syndrome. Different kids may have varying degrees of sensory-seeking behaviors, and the severity of these behaviors may vary from moment to moment throughout the day and also on a day-to-day or week-to-week basis. A smaller percentage of individuals with Angelman syndrome also exhibit what we call sensory aversions, and this may include things like sensitivity to noise, sensitivity to certain foods, or wearing certain types of clothing. And in these cases, we have found that an individual may actually want to retreat from a social situation or from a situation that's too loud or too bright. What can I do about treating sensory issues? Well, we know that teachers, occupational therapists, and actually some behavioral therapists are very accustomed to treating sensory issues. An individual who commonly mouths or bites objects, for example, might be given a chewy tube to wear around their neck, and you can refer to your screen for an example of what a chew tube looks like. And this might be accompanied by the instructions, bite this, not this. Individuals who are very easily overwhelmed in crowded or very loud settings, for example, may benefit from a smaller group setting or a very quiet space that they can retreat to just to calm themselves. Some individuals may be calmed while they're wearing a weighted vest or while they have a weighted blanket. We've also found that music may be calming and very reinforcing to some children who have sensory issues. Therapy may also incorporate movement, and this may include things like swinging or spinning. And in addition, we have found that if you can limit choices to no more than 2 to 3 options at a time, it's very helpful for individuals who have a lot of sensory issues and who may become easily overwhelmed when they're given too many options to choose from. Those individuals who have extreme sensitivity to textures, and this includes food textures, may be gradually introduced to a variety of textures within a therapeutic context. And this may include things like grass, shaving cream, and crunchy chips as an example. And you can refer to the pictures on your screen for various examples of that. Now, it's very important to note that sensory integration therapy, which is a term that's often used to describe treatment for sensory issues, is actually not an evidence-based treatment. And basically this means that there's not a scientific basis for those forms of intervention, and so therefore they can't be guaranteed to produce improvements in an individual's behavior. Nonetheless, it's been our experience that parents of many individuals of Angelman syndrome have anecdotally reported significant improvements as a result of various types of sensory integration therapy. In addition, we've had some parents who have noted improvements as their individuals with Angelman syndrome become older. In other words, as they move into adolescence and adulthood, they note that extreme responses to sensory stimuli have actually gotten much better over time. And this is very consistent with research that's actually been demonstrated in individuals with autism spectrum disorders.